Anterior canal BPPV is the rarest form of benign paroxysmal positional vertigo. It is diagnosed when the patient has a typical history of BPPV, but during the Dix-Hallpike test, the nystagmus is vertical downward, sometimes with a slight torsional component and often positive on both sides. This is opposed to the most common form of BPPV, posterior canal, where the nystagmus is vertical upward and with a rotational component towards the downward ear, and only positive on one side. Notice the downward nystagmus in this patient.
Oh, it stopped.
Anterior canal BPPV can be cured using the deep head hanging maneuver. It is not necessary to establish which side is affected using this technique, as the same maneuver is used for both ears. To perform the deep head hanging maneuver, have the patient go from sitting to the supine position with the head extended backwards as far as possible, so the patient's head is effectively upside down. After 3 minutes, move the patient's head forward as far as possible so that the chin is almost touching the chest. After another 3 minutes, sit the patient up. The procedure may need to be repeated. In this case, on repeat Dix-Hallpike testing, the patient had no vertigo or nystagmus and so was successfully cured.
It's good.
In rare cases, a patient with downbeating positional nystagmus can have a central cause for their symptoms, but they almost invariably have other abnormal eye findings such as spontaneous downbeating nystagmus or limb ataxia. Patients who are not cured by the deep head hanging maneuver should be referred for follow-up to ensure resolution and further evaluation and treatment as necessary.